But I wanted to tell you, for what it's worth, that for me this morning, there was a significant moment of revelation, which I found, frankly, thrilling, and it suffuses the molecular components of my body, and I want to convey it to you. I thought that the Chris Beirer presentation was a breakthrough, both in the content of the data and the analysis which accompanied it. And I want to try, if it isn't presumptuous, to convey from the point of view of someone working with colleagues in our little group AIDS-Free World, some of whom are here, I want to try to convey to you what it said to me. I don't want to overstate it, but I do want to try to divine the significance. I want to remind you, working, I think, correctly from memory, that there were 133 studies assessed, that there were 130 individual unique records taken, reports, that we then found, Chris found, reliable, unassailable data from 50 countries. There has never been such an assemblage of data in this field of MSM and HIV before. And overall, as everyone looked at the PowerPoint presentation, it was evident that in all instances, with only one or two rare exceptions, in all countries surveyed, the prevalence rates amongst MSM were astonishingly higher than the prevalence rates in the general population. And you had Ukraine, and the implications, the extrapolating implications were that those four countries, showing explicitly the decline in prevalence, could be applied to the larger region of which they're a part. But the point which is so extraordinary and for me so exciting was, of course, it wasn't just a decline in prevalence amongst men who have sex with men. It was a decline in prevalence in the general population. We've never been able to make that argument before based on such unimpeachable evidentiary base. It's quite extraordinary. So that now one has the reason and the legitimacy to make the argument by incorporating MSN into the broad integrated treatment network, we are serving the objectives of the entire population, and it then becomes 1,000 times harder for the Philistines to argue, in as much homophobic rhetoric as they can summon, that those who are in the realm of MSM must somehow be isolated, marginalized in the response. For the first time, we can make that argument about complete coverage, and frankly, it's a breakthrough by way of the epidemiological finding, because of the way in which the world has tried so hard to isolate MSM from the broad treatment prevention care apparatus. And then you throw up a series of slides on the wall to show that the entire general population of a country benefits. Precisely the interaction of all of that will probably be explained more fully at the plenary session next Thursday. But it is, frankly, an exhilarating advocacy weapon. I can't wait to get hold of some of these countries and to pummel some of these obdurate and idiotic presidents into submission. And this shouldn't just remain an epidemiological construct which animates public discussion. It's important that UNAIDS and WHO and the Global Fund and the World Health Organization and the World Bank and DFID and individual governments are pressed country by country. We have to stop some of the sloganeering and get down to the practical application of what we have learned and what we know, and now we know much more than we've ever known before. So let us put it to work country by country so that we can integrate the treatment in a way which we can now argue legitimately benefits the entire country. And it requires tremendous leadership. And it requires leadership not only to make the case in forums like this, but to go country by country, and Minister of Health by Minister of Health, and Minister of Justice by Minister of Justice, and presidential carrier by presidential carrier, and make the case to them and to the United Nations family. And I want to tell you that we can't lose this opportunity. This is amazing that it should coincide with this meeting on the eve of this International AIDS Conference, when questions of MSM and in conjunction IDU will occupy the centerpiece of the conference. And I want to make a point to you which is grievous to make, but I want to make it.